Warren, how big a problem is diabetes in this country?
Katie, there are 34 million Americans today who live with diabetes in the U.S., and there's another 80 million or 80 plus million that are pre-diabetic, and only 10% of them know it.
The situation is even more dire, I know, Warren, among people of color, and that Black Americans are more than twice as likely to die from diabetes than white Americans. Can you help us understand this staggering disparity?
A lot of time it comes from situations where individuals live in communities where we call health deserts or medical deserts, and having access to quality health care within these communities is a challenge. We have 4,000 of our pharmacies that are in underserved communities. And what that means is not only access to the medications, but also access to a pharmacist and a technician who are from those communities and understand the needs there on the front line. One of the barriers to healthcare and managing your healthcare is always cost, and you can argue it's probably always the first barrier. And so we know that by lowering the cost for cash paying customers, that reduces a barrier that one doesn't have to trade off between their food and their medication.
In fact, the cost of insulin is a huge issue, and many diabetics have trouble managing their disease because it's a huge financial burden. Walmart is trying to address that.
The American Diabetes Association tells us that it costs over $9,600 per year to manage your diabetes condition. And so at Walmart, we have the first private label analog insulin to hit the market. And with that, you can save 58% off a vial of insulin and 75% off a box of 5 flex pens.
How was Walmart able to develop, Warren, its own private label at such a low cost? And can people expect the same quality and efficacy in this lower priced insulin?
Our Rely On brand has been around for over 20 years. One of the things we're proud of is that we have one of the world's largest insulin producers, NovoNordisk, who came to the table with us. So this is the exact same FDA approved active ingredient. And we were able to bring our assets with the willingness of NovoNordisk and come and take the cost out that goes right back into the pockets of our customers.
What other resources are you all offering your diabetic customers in addition to this lower priced insulin?
That Rely On brand, we have OTC items. We know that testing your blood sugar is key. So you can get a box of 50 test strips for $9 and a meter for $9. So you can start testing your condition for $18. We offer medications on our $4 list. So we know that's important to have a wide suite of offerings for our customers to manage their condition. And that's one of the things we continue to innovate around at Walmart.
Warren, I know 90% of the population lives within 10 miles of a Walmart, and pharmacists are often the first line of defense for people. Are you able to also counsel them about healthy lifestyle choices?
Yes, and that's why it's important, Katie, to have the right offerings in the hands of our pharmacists, because our pharmacists are trusted, they're embedded in the community, they're there to answer questions and to make sure that our customers who trust us each and every month live to their fullest potential.